Hi, David Rosenberg here for another CAP Smart Take. And this is one that I think is especially timely and relevant. These authors look at whether or not the addition of fish oil to cognitive behavioral therapy management for youth with major depressive disorder is superior to cognitive behavior therapy alone in a placebo, double-blind, controlled, multi-center trial. And this is really important because we know that depression rates in youth, and I include adolescents and young adults, is skyrocketing. And we can't keep up. We now know that in college or university, there are unheard of rates of depression and anxiety, higher than ever before. And one of the big predictors of depression and anxiety in college and adulthood is depression in youth. And we know that as many as a third of all patients with depression don't respond to any existing treatment, and most patients who respond to treatment are partial responders. That is, they respond partially, but not completely, and have continued functional impairment. And the mainstays of treatment for depression are pharmacology, the antidepressants, SSRIs, SNRIs, other antidepressants, and cognitive behavioral therapy. And there's been some thinking that cognitive behavioral therapy or psychotherapy plus medicine might be most effective in most, but there clearly are some who do well on medication alone, some who do well on cognitive behavior therapy alone, some who do best on the combination. And we don't have good predictors at present who's more or less likely to respond to a particular treatment. And we still aren't able to predict who is more or less likely to respond to a particular treatment. And there's also been some thought that for more serious and more severe forms of major depressive disorder, that cognitive behavioral therapy alone may not be sufficient to get a therapeutic effect and may require additional medication intervention. But there are these intriguing studies that have suggested that the addition of fish oil to adult patients with depression can be very helpful. And that raises the question, can they enhance treatments such as the antidepressant treatments, such as cognitive behavioral therapy? But there are very limited studies in younger patients. In this case, the authors looked at adolescents and young adults 15 to 25 years of age. And specifically what they were looking at was whether or not long-chain omega-3 polyunsaturated fatty acids, or N3-PUFAs for short, what we call fish oil, what you get in the drugstore or the health food store that many take for a variety of reasons, for their heart, as well as depression, other symptoms. And the question here is, could this be, fish oil, a potential treatment for depression in youth? And so these authors studied patients 15 to 25 years of age with major depressive disorder and who sought care in one of 3 government-funded mental health services for young people in Australia. And these patients with major depression were randomly assigned in a double-blind parallel arm design to receive either fish oil, 840 milligrams of eicosapentaenoic acid, and 560 milligrams of docosahexaenoic acid, or placebo capsules as adjunct to cognitive behavioral therapy. And all participants were offered 50-minute cognitive behavioral case management sessions every 2 weeks, delivered by qualified therapists. Treatment as usual at the study sites during the intervention period. And the primary outcome was change in depressive symptomatology. Interestingly, they also measured erythrocyte or red blood cell N3-PUFA levels pre and post intervention. So what did they find? Out of the 233 patients 15 to 25 years of age, who were randomized to the treatment arms. 115 went to the fish oil group and 118 to the placebo group. And the bottom line is that there was no significant difference in change in depressive symptom severity in the fish oil or the placebo group. And erythrocyte PU-FA levels were not associated with severity of depression at any point in time. I suppose reassuringly, the incidence and severity of adverse events were very similar in the two groups, so the fish oil seemed to be well tolerated with no distinct or differential side effects from the placebo condition. So what's the bottom line here? This placebo-controlled trial and biomarker analysis found no evidence to support the use of fish oil for treatment in adolescents and young adults with major depressive disorder. And does this mean that that's definitive? No. Further study is clearly warranted. I think there are a number of issues: family history of depression, prior response, how many patients had been on prior treatments, prior antidepressant trials, prior cognitive behavioral or psychotherapy trials. That really needs to be addressed in a better fashion. I think that in addition, there are issues about other medications that patients may be on during the trial. The cognitive behavioral therapy itself in our clinic, when we do cognitive behavioral therapy for depression, it's typically done or at least offered every week for the first 12 weeks. And there is an intensity level involved in the cognitive behavior therapy. That, I think, would be an important determinant. And comorbidity can obviously make things more difficult. So a lot of questions raised, but there's no question that this is a well-done, important study. And on the face of it, there's no compelling evidence to suggest that fish oil enhances treatment response in young people with major depressive disorder treated with cognitive behavioral management.